Hello, I'm Anita, and this is Care Experts, brought to you by CareCredit. With the CareCredit credit card, you can get the dental work you want or need now. CareCredit is accepted at hundreds of thousands of locations nationwide for preventative, restorative, and cosmetic dentistry. Today we're in Los Angeles, California with Dr. Daniel Naysan. Dr. Naysan is a member of the American Dental Association and specializes in aesthetic smile design. He practices cosmetic, general, and emergency dentistry in the heart of Beverly Hills. Today we're talking about tooth extraction. Dr. Naysan, thank you so much for joining us today.
Thank you for having me.
We're so excited that you're here. So we're going to be talking about tooth extraction. I know that can be probably a little nerve-wracking to some patients. So can you tell me, how do you know exactly when a tooth needs to be pulled?
Usually there's a rule that dentists follow, and if there's not a specific amount of tooth structure over the gums, then the prognosis of that tooth is going to be poor. So in those cases, we pull the tooth.
So is there something that would have happened to cause this? Is it just is it trauma or is it just poor care?
Usually it's a combination of everything. You're talking about deep decays, you're talking about vertical root fractures, you're talking about failed restorations. So in a lot of cases, we try to avoid it, but once the damage is done, there's nothing you can do and you got to pull the tooth.
And what exactly is the process of extracting a tooth?
So it's a one-appointment procedure. Patient comes in, gets local anesthetic, and basically it's just a little bit of pushing the fibers away from the tooth structure where the bone is and using a forceps to kind of pull that tooth out.
So it sounds painful, but is it generally painful?
It is not.
Okay. And I'm assuming that the patient would be fully under, or is that something that you can opt to choose?
No, they could be awake, just under local. A lot of, I would say at least 90% of our patients that come in get it done under local anesthetic or some type of nitrous sedation.
So what kind of aftercare would you recommend to a patient after they've had a tooth extraction?
So one of the most important things after an extraction is done is not to cause any negative pressure in that socket. So drinking through a straw, spitting, smoking, those are things that can break the clot up and cause a lot of pain afterwards and doesn't allow healing of that socket.
How long do you have to adhere to these things before it heals?
At least a week.
Okay. And are there any side effects or complications of having a tooth pulled?
There usually is not if it's done by a seasoned dentist that knows what they're doing.
And it sounds like as long as you follow all of the aftercare and you make sure that you're eating the right foods and you're just letting it heal.
Exactly.
How long does a procedure generally take from start to finish?
For our surgeons in office, per tooth, maybe less than a few minutes.
Oh, wow. It's that short?
Yes.
Okay. So it's rest assured you're not going to be in the dental chair for hours.
Our oral surgeon, I pride on this guy coming and treat our patient. He can treat a set of wisdom teeth or 4 teeth, and he'll be in and out in 15 minutes.
Thank you, doctor. We'll be back with more Care Experts after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion on tooth extraction. So what's the recovery time after a tooth is extracted?
Really, it depends on per case, but I would say swelling could happen up to 72 hours.
Okay.
The clot usually takes up to 4 to 6 weeks to heal, but the patient doesn't know that. Usually after the first week, they're completely fine.
Is smoking advised after you've had an extraction?
So like I said, nothing with negative pressure. So
Okay.
the smoking causes that clot to be broken.
Yeah. Is there specific food or drinks that you recommend that are just better for you after you've had a tooth extraction?
Yeah, you want to stay on a softer food diet. You don't want to have
Okay.
anything that breaks up into small pieces like chips, almonds, so it doesn't get into that socket.
Smoothies are fine.
Exactly.
And what are the costs of having a tooth extracted?
So it depends on what type of extraction
Okay.
is being performed. Usually if it's a simple extraction, it's low as a couple $100s, but a lot of times the tooth is impacted with the soft tissue or the bone, and it can go up to about $1,000.
So for patients that might not have dental insurance, do you offer other financing options?
We do. We offer something called CareCredit. It's a financing company that helps patients pay it over an extended period of time so they don't have to pay a lump sum at once.
So before I let you go, I just want to ask, what is your favorite part of your job?
Favorite part of my job is really building relationships with my patients and delivering beautiful smiles and changing their lives and giving them confidence to feel good about themselves again.
It sounds like it really makes you happy and light up.
It does.
Well, thank you for sharing your experiences and all your knowledge with us.
Thank you.
Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. For more information, visit carecredit.com.